Hello, I'm Sophie Lee, and I'm going to talk about the expansion of the dengue virus transmission zone in 21st century Brazil. Dengue fever is an arbovirus transmitted by mosquitoes of the Aedes genus. It's hyperendemic to Brazil, and the past 20 years has seen an explosive increase in incidence rates across all regions of the country. Previous studies had identified geographical barriers to dengue diffusion, beyond which regions were considered relatively protected from outbreaks. These included the Western Amazon, which is a remote area of the country, and the south of Brazil, where seasonal temperatures were too cold for vectors to efficiently transmit the virus. These maps show the year of first outbreak as defined by the Brazilian Ministry of Health as over 300 cases per 100,000 inhabitants. We use this binary outbreak indicator within a Bayesian spatio-temporal model to better understand and quantify the expansion of the dengue virus transmission zone and identify potential drivers of this. We hypothesized that the southern border was related to climate suitability. Here we've shown the average number of months which were suitable for dengue virus transmission. Notice that the majority of Brazil is suitable for year-round transmission. However, the south of Brazil experiences very cold winters where Aedes mosquitoes are unable to transmit the virus. We also hypothesized that the Western Amazon barrier was a result of its lack of connectivity. Here we've extracted the level of influence of cities from the urban network in Brazil. Cities were categorized based on the level of opportunities and the movement between them into 5 categories. The top level was a metropolis, which is the largest cities in Brazil, which are connected throughout the entire country as well as internationally. And the lowest level was a local centre, which were only connected to themselves. We can see there's a stark difference between the Western Amazon, which is mostly disconnected from the urban network in comparison to the rest of the country, in particular the southeast of Brazil. We included these indicators as well as some others into our spatio-temporal model, and using simulations from the posterior distribution, estimated the probability of an outbreak. Here we've aggregated this to each decade by taking the average probability to show the changes in the risk patterns. We can clearly see the expansion in the dengue risk zone. It's especially clear in the south of the country where we can see this geographical barrier moving into the region. We found an increased odds of outbreaks in highly urbanized settings which had experienced outbreaks previously and had suitable temperatures for the Aedes mosquitoes to transmit. All regions which had a higher influence level than local centres had an increased odds of outbreaks. We intend to expand this model and improve it using monthly case data to explore the impact of more fine-scale climate changes and include factors related to any changes in connectivity over the period. Thank you for listening.